Hi, thank you for watching Digging to China. I'm Dong Xiang. China's top disease control official said current vaccines offer low protection against the coronavirus, and mixing them is among strategies being considered to boost their effectiveness. It is not surprising that China's vaccine has low efficacy rate. It is quite unusual that Chinese official admits it. China has distributed hundreds of millions of doses of domestically made vaccines abroad and is relying on them for its own mass immunization campaign. But the director of Chinese Center for Disease Control and Prevention, Gao Fu, said at a conference on April 10 that their efficacy rates needed improving. In the city of Chengdu at a conference when Gao delivered a presentation on Chinese COVID-19 vaccines and immunization strategies. He said, quote, "We will solve the issues that current vaccines don't have very high protection rates. It's now under consideration whether we should use different vaccines from different technical lines for the immunization process," unquote. He listed two options to solve the problem. One is to increase the number of doses or adjust the dosage or interval between shots. The other is to mix vaccines developed from different technologies. Mr. Gao also praised the benefits of mRNA vaccines, the technology behind the two vaccines seen as the most effective, Pfizer and Moderna. Gao concluded his presentation with praise for mRNA vaccines and called for innovation in research. He said, quote, "Everyone should consider the benefits mRNA vaccines can bring for humanity. We must follow it carefully and not ignore it just because we already have several types of vaccines already," unquote. Only a few months ago, China was questioning whether the then unproven method was safe. Gao previously questioned the safety of mRNA vaccines. He was quoted by the official Xinhua news agency as saying in December he couldn't rule out negative side effects because they were being used for the first time on healthy people, saying there is a safety concern. Chinese state media and the popular health and science blogs also questioned the safety and effectiveness of the Pfizer-BioNTech vaccine, though large-scale trials and the rollout of the vaccines in the US have established its safety. As Gao's comments gained traction on social media and made international headlines, Chinese censors quickly scrubbed discussions online, and the state media swiftly put out an interview with Gao to walk back his comments. In a message to the Associated Press, Gao said on the night of April 11, he was speaking about effectiveness rates for vaccines in the world, not particularly for China. He did not respond to further questions about which vaccines he was referring to. He directed the AP to an interview he did with the state-owned Global Times, which has published several articles raising doubts about the safety of Pfizer mRNA vaccine. Gao was quoted by the outlets as saying he was misunderstood and merely talking in general terms about improving vaccine efficacy. China has positioned itself as a leader in COVID-19 vaccine development and distribution, promoting and supplying its vaccines to countries all over the globe, including Indonesia, Zimbabwe, Turkey, and Brazil. The relatively low efficacy rate of Chinese vaccine, however, could hamper credibility and dent Beijing's so-called vaccine diplomacy. Experts say mixing vaccines or sequential immunization might boost effectiveness. Researchers in Britain are studying a possible combination of Pfizer-BioNTech and the AstraZeneca vaccine. China currently has 5 vaccines in use in its mass immunization campaign. 3 inactivated virus vaccines from Sinovac and Sinopharm, a one-shot vaccine from CanSino, and the last from Gao's team in partnership with Anhui Zhifei Longkong. The effectiveness of the vaccines range from just over 50% to 79% based on what the companies have said. The shot from Gao's team was given emergency use approval a month ago and has not publicly disclosed the data yet about its efficacy. Pfizer and Moderna's vaccine, which are primarily being used in developed countries, have both been shown to be about 95% in protecting against COVID-19 in studies. As of April 2nd, some 34 million people in China have received 2 doses of Chinese vaccines and about 65 million received 1, according to Gao. Globally, public health experts have said that any vaccine that is 50% effective would be useful, and many governments have been eager to use Chinese vaccines as rich countries around the world have snapped up shots from Pfizer and Moderna. According to World Health Organization, while 1 in 4 people in rich countries have received a vaccine, only 1 in 500 people in poorer countries have gotten a dose. Vaccines made by Sinovac, a private company, and Sinopharm, a state-owned firm, have made up the majority of Chinese vaccines distributed to several dozen countries. However, the companies have not publicly published peer-reviewed data on the final stage clinical trial research and have been criticized for a lack of transparency. Sinovac's vaccine, for example, raised concerns when it was found to have different efficacy rates from each of the trials it conducted in different countries, ranging from around 50% to over 83%. A Sinovac spokesman, Liu Pei-cheng, acknowledged varying levels of effectiveness have been found, but said that can be due to the age of people in the study, the strain of virus, and other factors. Beijing has yet to approve any foreign vaccines for use in mainland China. Thank you for watching. Please leave a comment and subscribe to my channel. Just click the subscribe button right here. I'll see you again shortly.